Hi everyone, Dr. Pannucci here. So what is a DIEP flap anyway? DIEP flap is a name or a concept that's thrown around a lot, and some people, even when they come in saying, I want a DIEP flap for breast reconstruction, they don't truly understand what does that mean. Those of us that regularly do microvascular reconstruction for acquired defects to the breast inherently understand that DIEP just refers to the anatomy used to keep the belly tissue alive. So let's back up for a second. I'm putting up an image here borrowed from microsurgeon.org. Dr. Rudy Buntick, a wonderful medical illustrator as well as microsurgeon, this is actually his image. But it shows you that the deep inferior epigastric vessels come from the external iliac system and then run behind your six-pack muscle, your rectus abdominis muscle, that runs vertically from the bottom of your rib cage all the way down to your pubis. As the blood vessel runs behind the six-pack muscle, it sends blood vessels through the muscle and out to the skin. Now, these are blood vessels that we can see on preoperative CT angiogram imaging studies and actually design an operation based on the imaging study with confirmation in the operating room. Now, in the operating room, there's different ways that surgery can go. A true deep inferior epigastric perforator flap shown here is a flap that has absolutely no muscle attached to that leash of blood vessels. Now, sometimes it's necessary to take a very small cuff of muscle around the vessels, as shown here. In my opinion, that's still a DIEP flap. Now, DIEP flaps can be one perforator, meaning that there's a single blood vessel that you track through the six-pack muscle and down to their source, or as shown here, 2 or even 3 perforator DIEP flaps. In addition, sometimes you don't have a dominant blood vessel, and so you take a cluster of small blood vessels. Now, when you do that, it can be dangerous to dissect right on the blood vessels, and instead you might choose to take a small cuff of muscles surrounding them. That's what's called a muscle-sparing tram flap, and you can see the muscle that is attached to the bottom of the flap, and behind that muscle, where you can't see, there are several smaller perforating vessels. And finally, also based on the deep inferior epigastric system, you can do what's called a bipedical flap. And as shown here, that's actually where for a one-sided reconstruction, you might dissect the right and left sides and hook both of those up to the internal mammary system. So important clarifications as you are talking with your surgeon about what type of flap might I have, what does my anatomy look like. Hopefully this gets you up to speed on the anatomy for free flap breast reconstruction. Thanks so much. Have a great day.